are all case studies and case series.
Good morning, Doctor. So you opt to do a case series study design. So what do you think is the strength and the weakness of your design?
It's lesser compared to the RCTs and the prospective trials, ma'am.
But what's the weakness?
The weakness, less subjects, so you cannot really conclude. You cannot really conclude on something.
So the level of
Yes.
evidence is low.
Yes, ma'am.
Okay. So, but even if you're doing only a case series, you should also include your exclusion and inclusion criteria. Why these patients? Why did you include them in your study? Then you have to also state yung as is, data collection, like that. Kasi when this paper, more or less para siyang, when you presented it, para siyang case report. Okay, so you bet, siguro you look into it on how to write.
Actually,
a
ma'am, we
case
are
series.
planning to have an RCT on our institution, but
Good.
since we have lack of time, we just
Ah.
presented the first 3 patients.
If you're going to do an RCT, it has to be a formal RCT in the protocol. You cannot use these 3 subjects, no? Parang case series siya as is siya, no? But if you intend to do a formal RCT,
Separate.
it is a separate protocol.
Yes, ma'am. Yes, ma'am.
And it has to undergo IRB
Ethics.
approval.
Yes, ma'am.
Dito kasi, wag mong ilagay na this study did not require an approval from the institution's ethics committee. Kasi if it is intended to be a study, dapat sabihin mo pa rin, dadaan siya sa, what do you call this, ethics review committee for, para ano siya, ma-exempt, for exemption. Ganon dapat.
Yes, ma'am.
Thank you, Dr. Makila. Okay, we have 3 more papers to present. So, yung 3 na lang ang hindi pa maka-relax. Ang 7 pwede nang kumain. Nakatapos na sila. Malapit na. Okay. So, for the 8th paper, may I call on Dr. Nina Johanna Antoine T. Lim on pericapsular nerve block for positioning patients with hip fracture for spinal anesthesia.